Hi, everybody. Thank you so much for tuning into this week's episode of Coping Together. My name is Faith, and I work with the Mental Health Association of Central Florida here in Orlando. I'm very excited, as always, to introduce our guest. This week's guest is Claudia Swonger, who's the Director of Behavioral Health Community Outreach for the Osceola Regional Medical Center. Claudia, how are you doing today?
I'm great. How about yourself, Faith?
I'm doing great. Thank you so much. So
Okay.
I would like to start. We all know, or a lot of us know, that it's July is Minority Mental Health Month. And today in particular, we wanted to talk about the mental health in the Latinx community and specifically the impact that COVID has had on it. Can you first give us a little bit of insight into your position with ORMC?
Right. So first, thanks again for having me. It's a great opportunity to talk more about such an important topic. So again, I'm the Director of Behavioral Health Community Outreach for Osceola Regional Medical Center. We do have a behavioral health department here where we have a 25-bed unit. It's a Baker Act receiving facility. We see adults ages 18 and up. It's also a crisis stabilization unit, and we also accept voluntary patients. And we also have an outpatient program where we have a PHP IOP, partial hospitalization program, an intensive outpatient program for adults as well, and that's primary mental health. And then we also offer ECT, electric convulsive therapy, and we offer that in the hospital as well. So that is our behavioral health service line that we offer.
Very cool. And so your position being the director of such, can you give us a little bit more insight as to what that involves?
Sure. So my job is to just make sure that our relations with our providers and with our healthcare partners are good relationships, just reaching more market, informing the community and the providers what our services are, and just making sure that our referrals and our admissions are done appropriately and in a timely manner to make sure that everybody gets their services that they need.
Well, thank you so much for your dedication and your position and what you do. And
Thank
I
you.
think that's a really great segue into today's topic because it's something that I know is very important to you and is important to so many of us. And that really is that in the Latinx community, as everyone is affected, with Minority Mental Health Month, I want to ask you about how you feel the Latinx community has been impacted by COVID-19,
Mhm.
especially given the concept of it being such a family-focused kind of community and population.
Mhm. So, like everybody, they've been, or we've been affected in many ways. Me being of Hispanic descent as well. So, one thing to understand that Hispanics are the nation's largest racial and minority group. So that's very important to keep in mind when discussing COVID and mental health and everything else. So, due to COVID and due to social distancing, it has affected our unique culture. And I call it unique because we are very uh, hugs, kisses, physical touch, dancing, outgoing, church going, spending time as a family, eating as a family. So, all that has
A lot of
changed,
bonding.
a lot of bonding. So that has changed a lot due to just the CDC precautions, social distancing, wearing the masks. Our elderly, we highly respect our elderly. So now that perhaps we're not able to spend as much time with them or spend that one-on-one time with them, that is affecting just family dynamics as well. And here in Osceola County, there is a 55.3% of Hispanic community. In Orange County, it's 28.7. So as you see, it's high. It's very high. So all
Yeah.
those factors we need to keep in mind when providing services to Hispanics.
And you make a really good point with that. And I want to kind of ask you, are a lot of people in the Latinx community facing any kind of language barriers right now with COVID-19 and receiving services like that with testing and everything? Or have a lot of the counties kind of acclimated for that and accommodated that?
So I know that they try, but the thing with Hispanics too is that we always try to seek services in our language, even if we may be fully bilingual, but that is our primary language for some. For some, they see it as not wanting to let go of their roots. So
And it's what
even
you're
though they do.
comfortable with.
Correct. Yes. That's what they feel comfortable with. That's how they express themselves in. So there are a lot of resources out there in Spanish, but I know that that's a barrier to them, and that kind of holds them back when seeking services, is thinking, oh, well, I won't find this service in Spanish. But my rule of thumb is ask, because you never know. And nowadays with the interpretation lines, it's just a phone call. It's just via phone, and somebody on the other line is there to help you interpret a session or just a certain service. So I think now it's getting easier, but that's always a barrier with the Hispanic community.
Absolutely. And just a real quick, I guess, plug for the Mental Health Connections program with MHACF. One of the things that we do have a few Spanish speakers in our office. So if you give us a call, you're welcome to talk with one of us. We'd be happy to walk you through our referral process and actually help find Spanish speaking providers in the area. That's something that I really enjoy doing with my job, is being able to help in that way and get people connected to resources that they're comfortable with.
That's great.
Yes. And so we've talked a bit about the social impacts, the language barrier. I know with Osceola County, there's a decent amount of a financial impact, or an impact on the employment rate, correct?
Yes, yes. So Osceola County has the highest unemployment rate in the state of Florida. They are right now at 31.1. I know that varies, especially now that they opened the theme parks and some things here in the Tri-County area. They're opening more, so that's changing. But it does have the highest, and Orange County is right behind them with the 23.2%. So those are all factors to keep in mind. And then again, relating them to the Hispanic percentage that is part of that. They are uninsured. So if they're unemployed, then there's no insurance. So yeah, that's another barrier regarding seeking mental health counseling or seeking any type of healthcare service. So that's something else that's holding them back to get
And
the services that they need.
And let me ask you, I know the stigma still exists in the entire country, but I know in the Latinx and Hispanic communities, there's still a substantial stigma as well with mental health, just because of the
Oh,
difference
yes.
in mentality, in the past.
Oh, absolutely. We don't share our personal problems or our personal concerns with strangers. What will others think of us? We worry a lot about being judged and labeled as crazy if we talk
Mhm.
about anything regarding mental health. And we depend on our family. We talk to our cousins, our extended family. Those most of the time are our counselors. But it is very different when you talk about certain topics to family members versus a professional that can really help you and guide you to get the help that you need. And also the lack of psychoeducation. People really don't know the issues with depression, anxiety, so they lack that psychoeducation as well. So that's something else that a counselor can help out with versus a family member to help you get through difficult times.
Absolutely. And I agree with you that it can be great to talk to family. It can be great to talk to friends, and especially in a community that, like you said, is really based on bonding and that familial aspect. Those are the people that you go to for everything. I can only imagine that it's hard right now to have that legitimate barrier, not even
Yeah.
figurative, but real barrier, where you can't see those people. And so I do think you make a good point that it's important to try to introduce that it is okay to go see a counselor, but I understand that that's really hard to do, to shift an entire mentality. And so that kind of leads me into one of my last questions for you, which is, what are some of the resources that exist right now, for
Mhm.
everybody, but primarily are focusing on as well for the Latinx and Hispanic communities? What are some resources in the area right now?
So again, a lot of these resources are in Spanish, but NAMI, and especially NAMI of Greater Orlando, NAMIGO, they have their website in Spanish as well. They have wonderful resources, support groups, educational series such as this one, and mostly online, but eventually, of course, in person. So definitely start off with NAMI. That's the National Alliance of Mental Illness. Then, of course, CDC. CDC is in Spanish as well. a lot of statistics, a lot of numbers, a lot of educational resources to fully understand COVID and just everything else that's going on. Parents can request a therapist in Spanish through their school, through their insurance program. One thing that I didn't mention regarding the Hispanic community is it's important for them, for their family to be involved in their treatment. So just something to keep in mind, that when maybe perhaps it's an individual session, it's important to involve the family members, because for them, what their family says or their family's opinion is very important. So that's very important to keep in mind when seeking Spanish-speaking services, is a therapist that speaks Spanish and a therapist that understands the culture and understands the importance of involving everybody in treatment, not just the client, but everybody else in the client's lives. So parents can seek therapists in Spanish. EAP, Employee Assistance Program, a lot of employers have this program, and they have therapists that speak Spanish as well. And then, of course, 211 through United Way, they have options in Spanish on the phone, and on their website, there's also resources in Spanish. So again, my rule of thumb is ask. Do you have anybody that speaks Spanish? I need somebody that's bilingual. And most of the time, they will have somebody. If not, request an interpreter, because per law, you are entitled to have an interpreter assist you.
I appreciate you making that clarification that it's a right to ask for an
Yes.
interpreter. It's not
Yes.
being a hindrance. It's not asking for too much. It's something that you are, legally entitled to, which is important when it comes to receiving any kind of services for your health, but even, like, specifically mental health. And one thing I really do want to say is that I think you make an excellent point when talking about different cultures. It's not just enough about knowing the language. It's also being considerate of the culture and of how important and integral that is for somebody. And especially from my knowledge and from the people I've spoken with, that's very true in the Latinx and Hispanic communities.
Absolutely, because there's so many countries that speak Spanish, and there's different dialects of Spanish, and there's different cultures. So it's not just understanding the Puerto Rican culture, the Mexican culture, it's everybody else's culture.
Yeah.
And it's not cookie cutter. Everybody's different. It's the same
Absolutely,
language,
yeah.
but it's a different culture. So
I
it's
think that's
understanding.
true.
Yeah,
Yeah.
it's understanding the different cultures. Absolutely.
Absolutely. And so I know that one thing that I was excited to talk to you about, and I think this is probably where I'll close, is Osceola Regional Medical Center. Are they offering any resources right now?
Absolutely. So we fall under the umbrella of HCA Healthcare, and they are doing this nationwide. It is a resource for people to find options to get insured, because I know our biggest concern right now is people not having insurance due to unemployment, not having insurance, or not being able to afford COBRA. So there is a phone number for you to call. It's nationwide. It's open Monday through Friday, 8 a.m. to 6 p.m. Eastern Standard Time. It's a toll-free number, and there are case managers on the other line that will help you find resources for you. A lot of people don't know the ins and outs of Medicaid, don't know the ins and outs of affordable health care. So the person on the phone will help you find what best fits for you, and will help you apply for an insurance plan that you are able to. So if I may share, do you want me to share the phone number, or?
Absolutely, please.
Okay.
And we will also post, we're going to post that in the comments below. You'll be able to see the phone number. We'll include ORMC's website, as well as our contact information as always. So please go ahead with the phone number whenever you're ready.
So it's 833-541-5757.
And just to confirm, I'm assuming that that hotline also has a Spanish option as well for Spanish speakers?
I believe so.
All right. Well, thank you so much for being on here, Claudia. I really appreciate it. I really value getting to learn more. I think that education is power. Education is how we make a change. And I think that that goes a long way when it comes to understanding different cultures and being considerate of that, especially in the mental health field. So I really appreciate you coming on and talking with us. I
Thank you.
am grateful to all of you for watching as always. If you have any questions, please reach out to us. I would love to hear your ideas for topics you want us to talk about, things like that. And Claudia, again, just thank you so much. And I hope you have a wonderful day. And I hope you all have
Thank
a
you.
wonderful day.
Thank you, Faith. You too. Have a great
Thank
day.
you. See you guys
Bye.
next time. Bye.